Welcome to the HIV and AIDS 101 program, Module 1, brought to you by the Florida Department of Health. During this video, you'll learn more about the history of HIV, how the disease affects the body, the difference between HIV and AIDS, prevention, testing, care, and more. Throughout the program, your moderator will have the opportunity to provide you with more detailed information on the presented topics during the indicated chapter breaks. For those participating in Modules 2 and 3, please have your instructional materials ready for review at this time. We'll begin with a brief history of HIV. When you're ready, please proceed to Chapter 1. Even if you weren't aware of HIV when it first emerged in the 1980s, it's likely that you've heard of HIV or AIDS and know that it's been part of our communities for some time. HIV was identified almost 30 years ago. At that time, it was a rapidly spreading disease that terrified and puzzled the nation. We didn't know much about it. We didn't know how to treat it, and we didn't know how to care for people who were infected. Since then, available testing technologies have improved dramatically. Medical treatments and other advancements have significantly extended the lifespan of HIV-positive people.
First of all, the tests are non-invasive. If you choose to do it that way, you can start with an oral swab, which is highly accurate. You can even do a home test kit, which is newly released by the FDA. So there really are, very few excuses for people not to want to get tested. We recommend that everyone between the ages of 15 and 65 get a routine test. So testing is much more accessible, much easier to do, and the technologies are much more accurate than they've ever been. The medications now are much better than they've ever been. I mean, we're talking about single-dose medications that have a very low side effect profile. They're not going to be hard on your stomach. They're not going to be hard on your other organ systems. They're going to be very tolerable. You can remember to take the medication because it's only once a day, and you're going to be able to live with the HIV without any serious complications from the medications. And it's also highly effective medications. They're very effective in lowering the viral loads. So it's like the best of both worlds.
In many respects, a lot has changed since the 1980s. Getting tested for HIV is easier than ever, and your options of how to get tested are plentiful. HIV is no longer an immediate death sentence. Early medical treatment can add decades to the life of HIV-positive people.
Well, many years ago, this was a very bad disease where young people died from it in large numbers. And today, it's a disease where you can put it in check. You can take somebody with a viral load that's significant and you can knock it down to unmeasurable levels. And people can live for many, many years. I mean, we have the example of Magic Johnson, somebody like that, who's a well-known athlete, and he's lived for many, many years with HIV. So we now have very effective medicines where people can live a long, healthy, productive life. And as long as they're under good care, they should do very fine. And that's the whole different story about HIV disease today.
However, some things have not changed. There's still a lot of misinformation and myths about HIV that continue to challenge our ability to fight the disease. So what exactly is HIV? To put it simply, it's a virus that compromises the immune system. Once the virus is present in the body, it invades and destroys T cells. If this process goes unchecked, it continues until a low number of T cells and high viral load are present. This leaves the body increasingly susceptible to infections, infection-related cancers, and opportunistic illnesses.
The virus is particularly bad because it attacks the T cells. It essentially takes over the immune system's ability to fight against that virus. So it gets inside the T cells and it really takes over their function. And it hides in there and it begins to replicate itself. And literally within a day, it can replicate billions of copies of itself. So by hiding in there and destroying some of the essential fighters against disease in the body, it then leaves the rest of the body vulnerable to what it's going to do with its virus. And so it's particularly paradoxical in that way.
The immune system is designed to protect our bodies from invaders and pathogens like bacteria, viruses, and other parasites. When a pathogen-invading cell or antigen, such as HIV, enters the bloodstream, the immune system reacts, producing antibodies specific for the destruction of that antigen. T4 white blood cells, also known as T4, CD4, or T cells, are part of the immune system that act as commander cells, giving orders to other killer cells to attack invading antigens. However, because HIV targets and enters these commander T cells, it is able to hide from these killer cells, causing the immune system to fail and leaving the brain, heart, and other organs vulnerable for infection. Once in a T cell, HIV begins reproducing and is capable of creating billions of new cells every 24 hours.
The HIV hides in a particular type of T cells, and then it replicates itself. So it's hiding in there, and it begins to make copies of itself in the billions within hours. And it begins to take over the function of those cells to make copies of itself. And by making so many copies, then it leaves the rest of the organs in the body, such as the brain and the heart, vulnerable to its infection. So the HIV virus can then attack these vital organs and cause its very harmful effects. And as well, taking out the immune system that would fight against the HIV virus.
When someone is infected with HIV, the virus never leaves the body. Left untreated, HIV is almost universally fatal because it eventually overwhelms the immune system, resulting in acquired immune deficiency syndrome, more commonly known as AIDS. HIV stands for Human Immunodeficiency Virus. Human meaning the virus can only infect human beings. Immunodeficiency meaning it causes the failure of the body's immune system. And virus because it takes over the machinery of the human cell. HIV is the virus that causes AIDS. The distinction between the virus and the syndrome is one that's important to make. Over the last several years, there's been a movement away from saying someone has AIDS, instead of referring to those who have the disease as HIV positive. This is just one step toward continuing to lift the burden of stigma.
Number one, I think education is key. I am an HIV/AIDS educator as well, and I think that is key today. And just to know that people that are infected, we're really no different than anyone else. You know, we need love, we need support, we need guidance, but really for myself and my family, I would speak for us that, you know, we don't want to be treated any differently. Oftentimes we face everyday life things just like everyone else, but on top of that, we face the doctor's appointments, the medications, the stigma, the fear, the ignorance, and life is tough anyway. And then you manifest it with all of those components, and it can be very difficult. I do have 6 children. Only one is infected, but of course they're all affected. And throughout their years of growing up and us being in I would say pretty much average neighborhood, we faced a lot of ridicule. Some of our younger children were not allowed to attend certain activities. Our daughter that is infected, she actually used to play soccer. She was an avid soccer player, and she played probably for about 14, 15 years. And I remember one season, the coach actually had, not my daughter's coach, but on another team, they forfeited the game because they didn't want their children playing against my daughter. And that hurt my daughter very much. But of course, my other children in growing up, they got to see and witness all this as well. So it was hard for them, but it was a great teachable moment for me as a mom because I was able to step in and share with them that just because other people don't do the right thing or they're mean or show animosity that's not right for them to do the same thing. So I just kind of turned it around, no pun intended, but something positive, into something positive, so that I could have, my children learn from that as well.
The worst thing that ever happened to us, though, of all the bad things that happened, when people say, what's the worst thing that ever happened? It was Easter time, and it was 1995, and someone had put our name on a prayer list at a local church. And as the minister read down the list, he got to mine and Dan's name, and he told his congregation he couldn't ask them to pray for our health. All he could do was hope that we died quick. Now that was horrible in itself, but what made that tragic is that the lady who put our name on that prayer list was an older woman. She was a mother, a grandmother, and she had AIDS, and nobody knew it, not even her own children, because she was scared if she told them, they wouldn't allow her grandchildren to come to her home anymore. And so now her minister is standing in the pulpit praying that the only other person that she knows that's HIV positive would die quick. And of all the things that happened, that's the biggest thing that stuck with me at the time, and pretty much was the thing that catapulted me to know that I was doing the right thing being public, because if that kind of thing was happening to me, someone who had a story that people felt sorry for, that were moved by, imagine what was happening to the people who had no voice at that day.
If we can do anything by shooting this video or by helping someone, we want to educate them and help to reduce the stigma or help to lessen some of those barriers. We want to make it not the exception to the rule, but the rule that everyone needs to talk about HIV testing and STIs. We want to make it the rule that everyone walks around with their HIV status as a proud thing, as opposed to talking about HIV as being the stigma. We want to make that the rule, and not talking about it, that's the stigma.
AIDS, as mentioned in Chapter 3, stands for Acquired Immune Deficiency Syndrome. Acquired means it's passed from one person to another. Immune references the body's defense system. Deficiency means shortage. And syndrome, which indicates that a combination of symptoms and diseases may be present.
We've come to use the word HIV today much more, and there's twofold reason for that. One is that people are living much longer with HIV infection. Number two, we think that that's less of a stigma. The word AIDS had a stigma to it, and the disease carries too much of a stigma. So it's to destigmatize the whole process. People living with HIV carry a stigma, and we don't want that. We don't want people to have a stigma. We don't want people to have a stigma about being tested. We don't want people to have a stigma about living with HIV. And AIDS is an older term, and it has to do with the late stage complications that we talked about.
Once HIV begins to destroy the body's immune system, the affected person may progress through different phases of AIDS until death. Thanks to improvements in care, the time period in which someone who is HIV positive has AIDS has significantly decreased over the years.
Now, in the early days of this infection, I saw patients who developed the pneumonias, who developed the parasitic diseases that affected the brain and the eyes and these other things, or the cancers, Kaposi sarcoma. These were terrible diseases, and of course they ended up dying of them eventually, because in those days the medicines weren't effective. It wasn't until the later 90s that we had the antiretroviral medicines that we have today that are much more effective. And so it's so much different today. But today the vulnerability is that young healthy people don't know they have the disease, don't get diagnosed in time, end up with very late disease where it's almost too late, and sometimes it is too late for them to get the help from the medicines that we do have today that are very effective. So we still see young healthy people dying because they're diagnosed too late.
It's important to remember that a person infected with HIV may not show symptoms for 5 to 10 years. People who look completely healthy can still have HIV and can pass the virus on to others at any time. An individual who is newly infected with the virus or has an acute HIV infection has large amounts of the virus in their system. Having large quantities of the virus in the blood increases the likelihood of HIV transmission to others. In Chapter 5, you'll hear more about the ways HIV can be transmitted. If you are studying Module 2 of the program, please pause the video at this time to review the history of HIV, stages of infection, and is there a cure sections of your materials before moving on to Chapter 5. HIV can always be passed to others, even if the carrier has no symptoms of AIDS. Anyone can become infected, regardless of age, gender, social class, or sexual orientation.
If you know it or not, you probably have known someone that is living with HIV and/or AIDS. And I think one of the points that I really like to share with people is that it doesn't matter who you are, where you came from, what your lifestyle was like. I mean, it does matter. Most people have morals and values like I do, but at the same time, I truly believe that nobody deserves this virus. And I think one of the things that hurt me the most today is when, I hear about people dying alone. Because there is so much stigma, fear, and ignorance that's associated with the virus, and a lot of times people, they lose family members, not lose as in dying or passing away, but they lose them because they shut them off, or family and friends, and I mean, it can just be a snowball effect. And it's so sad for me, especially in this day and age, how far we have come, the knowledge that has been gained. And a lot of times people say, well, there's a lot that is not known about the virus. That's true, but again, no pun intended, but on a positive note, we have learned so much more today than what we knew in the past, and that's what I choose to focus on.
The virus can be transmitted through blood, semen, including pre-ejaculate, vaginal secretions, and breast milk. HIV can be contracted through sexual contact, including vaginal, oral, and anal sex, sharing hypodermic needles during IV drug use, and mother-to-infant transmission via in utero exchange during birth or by breastfeeding after birth. The U.S. screens donated blood for HIV, but very rarely, in countries where blood is not screened, transmission can also occur through transfusions of infected blood. Many myths surround HIV transmission. You should know that HIV cannot be contracted by sitting next to someone, shaking hands, giving a hug or dry kissing, using restrooms, water coolers, or telephones, eating in a restaurant, using the same utensils, drinking cups, etc., swimming in a pool or using hot tubs, being bitten by an insect or by donating blood.
There are an awful lot of myths out there, and they really have to be debunked. And we can try it with social media, we can try it with websites. You can't get AIDS from a toilet seat. You can't get AIDS from, somebody sharing a cup. You can't get AIDS from sitting next to somebody. You can't get AIDS from a mosquito. You can't get AIDS from dry kissing. You can't get AIDS from hugging someone. You can't transmit HIV from sitting next to someone on an airplane. The scenarios are many that people create in their minds, but these are all myths. And so everyone who is informed has to be about the process of trying to debunk the myths. There's so much fear, there's so much stigma, and education and information is the way to overcome both of those, the fear and the stigma.
The dichotomy is still really amazing. I think the biggest stereotypes that still exist, though, are that it happens to only those people on the other side of the track. And so as long as I stay on this side of the track, it's not going to happen to me. And whatever that track is, and that track is different for different people, but people all have a track. And as long as they stay on this side, it's not going to happen to them.
You can help protect yourself against HIV. There are 3 major steps in prevention: knowing your status, knowing your risk, and managing your risk. Having your blood pressure and cholesterol and other vital conditions checked is standard when it comes to taking charge of your health and well-being. Getting tested for HIV and knowing your status should be a standard part of your health routine. If you are low risk, getting checked at least once is recommended. If you are higher risk, consider getting tested semi-annually or annually.
If you think about your private physicians, when you go to your private doctor, how many of you can say that your private doctor has talked to you about an HIV test? And the answer is usually not many. Even gynecologists don't ask that question because, well, you don't fit the profile. And that's the reality. We still very much have a profile to this disease. And that's where we got to break it. You know, that's the only way we're going to change.
Sometimes people are infected because of a bad choice they made or choices, but there are also many stories out there where circumstances happen beyond their control.
Knowing is being able to do. Knowing one's status, you can then do something about it. If you're negative, you can continue to remain negative. You can take steps to reduce your risk, and you can take steps to inform and educate others. If you're positive, you can get care. You can get into care immediately and take steps to reduce your viral load to negligible levels, where A, it can't harm your body, and B, you really can't transmit the virus to other people. You can take those steps to reduce the transmission likelihood to anyone else.
If you have one or more sexual partners, be sure to use condoms. Condoms are highly effective at preventing many types of STDs, including HIV, when used consistently and correctly. Condoms should be used from start to finish during sex. Latex condoms are more effective for preventing HIV and other STDs. Lambskin condoms are porous, meaning they have small holes, which make them ineffective in the prevention of STDs. Those who have latex allergies should use polyurethane condoms. Lubrication is essential when using condoms, but it's important to use the correct type. Oil-based lubricants like baby oil, lotion, or massage oils should never be used with latex condoms because it causes the latex to break down, which can potentially lead to condom breakage. Be aware that condoms containing the spermicide nonoxynol 9 do not provide any additional protection against HIV and other STDs, and should only be used for the prevention of pregnancy when both partners are monogamous and STD-free. The female condom, which is made of polyurethane, is also an option for women to protect themselves against HIV and STDs. Lastly, never use 2 condoms at once, either 2 male condoms or male and female condom, as friction between the condoms may lead to breakage. Abstaining from sex is the only sure way to prevent infection through sexual contact. But practicing mutual monogamy, where both partners in a relationship are HIV negative and only having sex with one another, is a way to be sexually active without risking infection. Additionally, those who work in environments where occupational exposure may occur must practice standard precautions to prevent HIV infection in the workplace. People who may be exposed to blood or other body fluids while on the job, such as EMTs, nurses, and tattoo artists, should exercise caution when handling sharp instruments and should use protective barriers in situations where they may be at risk.
Well, I'm going to start out with the one that most of us don't think of, tattoo artists. But then the ones that we all think of, EMTs, nurses, physicians, trauma surgeons, being on the battlefield in, wherever. Yes, where people are exposed to blood products or blood. But if you're dealing with needles, like a tattoo artist, yes, there's a risk of HIV transmission, isn't there? Or if you're dealing with, body art, where you're puncturing, you could have a risk. So think about those professions too. So, as we're talking to young people, as we're talking to cosmetologists, and we're talking to these different professions, wherever you're having blood exposure, that is a risk. And then you have to worry about what we call universal precautions. So whatever the profession is, you either have to protect yourself and use universal precautions. We're talking about latex gloves. We're talking about face shields for somebody who's an EMT and they're working on the highway trying to take somebody out of a vehicle. Last night I came upon a vehicle, 2 cars collided right in front of us, and one flipped over the other. And you don't know what kind of things you're going to run into on the roadway. Was there any bleeding? No, fortunately. But be aware of all these scenarios that you're going to encounter. So perhaps we all should have latex gloves. Perhaps we all should have protective barrier methods, because we never know what we're going to come upon to have to help somebody in a situation like that.
Healthcare workers who have contact with blood or other potentially infectious materials can be at risk for exposure to HIV or other blood-borne pathogens, including hepatitis B and C. The risk is higher with one or more of the following factors: exposure to blood from a terminally ill AIDS patient, exposure caused by a needle stick, which was used in a blood vessel, exposure caused by a visibly bloody device or a deep puncture. Medical authorities recommend that healthcare workers use appropriate standard protections known as universal precautions, such as latex gloves, gowns, and masks when exposure to the body fluids of a patient is expected to occur.
It's absolutely essential. So for healthcare workers, that's part of the requirements. It's OSHA requirements. So hospitals and healthcare facilities and organizations are required to follow protocols. That's federal law and state law. So the healthcare workers have to follow that. The same thing applies to codes for EMS workers, fire response, emergency vehicles. Everyone is under these various protocols. So it depends on the workplace, it depends on the protocols, but we have occupational safety and health protocols for various professions. And similarly with state licensing for business regulation, we would have this for the various professions too. And that's why there would be required training in this area for HIV 101.
Engaging in risky behavior can increase risk for contracting HIV. Having oral, anal, or vaginal sex or engaging in any activity where pre-ejaculate or vaginal secretions are present without the use of a condom increases your risk for infection. Having unprotected sex with one or more partners can be unsafe, especially if the HIV status of the sexual partners is unknown. Be aware that in addition to alcohol, drugs like crack cocaine and methamphetamines can be associated with increased risk, as they can lead to decreased inhibition.
The other thing about relationships is this. I have people come to me all the time. They'll be in my class, they'll be asking lots of questions around testing and different things, and I'll say, well, have you been tested? And they'll say, oh, no, I've been with my husband for 7 years. And I say, well, were you tested before? Well, no. If you continue that conversation with them, if you ask them if they use condoms, the answer is always no. Well, I've been married for 7 years. But they went into that relationship never having any STD testing done. So they have this false sense they're safe and nobody's infected with anything, yet they never had any tests done. Your definition of monogamy must be the same as your partner's definition of monogamy. And if it's not, then you need to be tested.
Well, first is the definition of committed. What is that? And what is that in a relationship? If we're speaking that a person is just going to be monogamous and it's mutual, there are other risks that can bring on the disease. First off, does the person know the status of the partner that they have when they got together? Have they both been tested? That said, on the side, with there being so many opportunities for people to be infected by blood, either through tattooing, if it's done and it's not done correctly, the person isn't certified. There are body enhancements. People will give themselves shots or share shots for enhancing breasts or whatever. That needle is shared. If someone is taking steroids and is sharing it and doing it illegally, there's another way. Also, the one that people don't think about is if I have diabetes and I'm having to inject insulin, and I don't have the money to get a needle, I may share it with someone else. There's another way of transmission. So it's just not a sexual transmitted mode. It could be through blood, and the blood can be through those various things that I just mentioned.
Well, again, by doing more testing, which we hope everyone gets a test, we will find these early treatable infections, and people will get on medication which is highly effective, and it will prevent the complications. So if they do develop HIV, they will be under good care, and they will be successful in keeping it at bay, keeping their viral loads to negligible or unmeasurable levels. They won't transmit it to other people. They will remain healthy, they will remain well, and they won't develop these later stage complications. So if they eventually do break through and become viral resistant, as we call it, they will have a much shorter time period where they would actually be sick. That's what we're talking about.
Let's say, for instance, if you are tested every single year. In 2006, the CDC and HRSA gave recommendations that everyone sexually active between the ages of 13 and 65 needed to be tested on a routine basis at least once per year, or if they are at risk, IDU, MSM, men who have sex with men, if they had any other higher risk factors, they may be needed to be tested more often. If you fall into those categories, go ahead and get tested more often. But if you know that you are negative in 2009, negative in 2010, negative in 2011, if you test routinely, it's like getting a baseline test. So if you know that you were infected in 2012, well, I know that I've had these negative tests all during this time, and I've only been with 2 people from 2011 to 2012. So it greatly reduces the stress of, well, who did I get this from? Who could I have spread this to?
The other piece of that is oftentimes people say, well, I started dating him or her and she was a virgin. Well, that's great, but I have 400 kids in this state that call me Mama Kathy, and of those 400 kids, half of them are HIV positive and they were born that way. And so they haven't had sex either, they are a virgin, but they're HIV positive. And I think that's the new land that we're in. So testing is the most important thing. Whether you're partnered or unpartnered, single or married, get a test.
If you are studying Module 2 of the program, please pause the video at this time to review the condom use, prevention for positives, and high-impact prevention sections of your materials before proceeding to Chapter 8. Florida has one of the largest publicly funded HIV testing programs in the country. HIV testing is available in every Florida county health department, as well as many community-based organizations, private doctors' offices, hospitals, clinics, drug treatment centers, and more.
It's extremely easy. Anywhere in the state of Florida, you can text your zip code to 477-493. It's a free text your zip statewide promotion, and you can get a listing of free HIV testing sites anywhere in your vicinity, and the listing will come back to you within a matter of seconds. You have CBOs or community-based organizations that offer free testing that are sponsored by the state. You also have health departments that offer testing free or on a sliding fee scale, which means if you don't have the method to pay, the fee can be waived or greatly reduced. Doctors' offices are now being reimbursed because it has moved to a Category A, which means that Medicaid, Medicare, as well as private insurances are now reimbursing for those testing practices. So if someone wants to get tested, they can definitely find a place to get tested.
You would think that everybody would know that you don't just know that when you go to your doctor's office, you're not tested for HIV. You're not tested for HIV unless you give permission. They have to ask you, and you have to give permission to be tested. I can't tell you how many people think that they know their status because I go to the doctor twice a year and he tests me. And so that's one message to get out, that you're not tested unless you ask to be tested. you're not tested. Routine testing, what the CDC, the Center for Disease Control, wanted was for it to become as routine as any other blood work you get once a year or twice a year. It will reduce the stigma if everyone is tested and not just a group of people.
There are several HIV testing products and technologies used in Florida. Each test uses a different process for determining if a person is HIV positive. Some use blood or dried blood, while others use plasma or oral fluid. Today, rapid tests and in-home technologies offer fast results. A point-of-care rapid screening test can find HIV antibodies in either an oral or blood sample and can produce results in a matter of 40 minutes or less. Before administering the test, a counselor or medical professional will explain the test to you. During that time, you can ask questions and discuss your risk for HIV. Then he or she will take a little blood from your arm or finger, or ask you to rub your gums with a collection swab. Know that a reactive result from a rapid test must be verified with a follow-up test.
There are various types of tests available today to do an HIV test. There are home testing, and there's testing that can be done at either a health department, a local community-based organization, or your doctor's office. And it goes from intravenous, doing a doctor pulling blood from your vein to test, or you can use a test that checks for HIV antibodies. It takes the body 15 days to 3 months to build up HIV antibodies, and we refer to that as the window period. So if a person's been exposed within that period, these tests may not be accurate. But in most cases, if the person is infected, the tests are 99% accurate. Some are 99.3% accurate to 99.7%, depending on the test.
Testing is always confidential and can be anonymous, meaning you can be given an assigned number instead of your name for collection and results purposes. However, after an HIV positive diagnosis has been given, one must forfeit anonymity in order to receive care. Medical records for those who test positive and receive care remain in the strictest confidence.
A confidential test is different from an anonymous test. A confidential test, for instance, if you go in and you test at your doctor's office and that test is positive, that doctor as well as that lab have the responsibility to report back to the Department of Health no matter where you test. If that test is positive, it's going to be reported back to the Department of Health. It's not going to go into some database. Your name is not going to go into some server. It's confidential in the matter that all of your information is protected and none of that information can be released. An anonymous test, on the other hand, you don't give your name, you don't give your date of birth, you don't give your social security number. And if you don't have your return appointment card, it's a small green scan ID card, or your scan ID number, you won't get those results. Those numbers are not reported. An anonymous test is just that. In order to access care in the state of Florida, you do have to have a confidential test. If you move here from another state, New York for instance, you would still have to test, have proof of positivity. That means you would have to go into a clinic or community-based organization to have a letter that says this person is positive. That's proof of positivity, a lab reporting form to get linked into care. Now, if you have an anonymous test, all that you have is a scan ID number and a piece of paper. That can be anyone's. You cannot get linked into care with an anonymous test. And linkage to care is extremely important in order to lessen the spread of the virus.
A negative result from HIV testing can mean either you don't have HIV or you have HIV but are in the window period before antibodies are detectable. Because it usually takes 2 to 8 weeks after infection for antibodies to present themselves, it's important to get tested regularly if you are at risk. Rarely, the window period can last up to 6 months. A confirmed negative result is yet another incentive for you to continue to manage your risk in order to remain HIV-free. A confirmed positive test result means you have the virus and can infect other people. It's crucial that you find a healthcare provider right away, because early treatment can help you stay healthier longer.
A young, healthy person could get an acute HIV infection and they could think it's like mono. They could think it is a sore throat, swollen glands, a fever, self-limited, sick for 3 or 4 weeks, a lot of fatigue, and it acts like a mono illness. A physician could actually miss it. And unless you specifically look for the HIV virus, you're not going to find it. So you can miss it because it can look like other things. In the meantime, that HIV virus has nested itself in the T cells and begins to do all these harmful things to the body. So it can literally take over the immune system, begin to replicate copies. It can go into a dormant period where you don't even know you have it. You can then become infective of other people. You can transmit it to other people. You can develop these reasonably high viral loads, and over time, you're going to become sicker and sicker.
The sooner we can get someone on medication and reduce their viral load, suppress their viral load, it just improves the quality of their lives. It also reduces the potential of spreading the disease. The lower your viral load, the less virus you have in your system. You just don't have as much virus to transmit. When a person is first infected or first contracts HIV, the virus goes crazy. It just starts, it's just a field day. So you could go from 0 copies to 1 million copies of virus. When we suppress it with the medication, we're getting it below 500 copies. So the difference is that much, and that's when you'll hear people talk about they're undetectable, because under 500 copies, I think there is a test that can detect 300 copies, but after that we really can't. We consider that undetectable. Undetectable doesn't mean cure, but it means way less copies of the virus in your system, and so it is. It's harder to pass it on. It's not impossible, but the chances are drastically reduced.
If you are studying Module 2 of the program, please pause the video at this time to review the occupational exposure to HIV, commonly used drug substances and other sexually transmitted diseases, and their connection to HIV sections of your materials before moving on to Chapter 9. In Florida, HIV testing is guided by law and carefully states that healthcare providers and other registered test sites may conduct HIV testing. For pregnant women, HIV testing is a mandatory offering at the initial prenatal care visit and again at 28 to 32 weeks into pregnancy. If a woman objects to testing, a written and signed statement of her objection will be placed into her medical record and no testing will occur. If a pregnant woman is HIV positive, she can transmit the virus to her baby. An infected woman may pass HIV to her unborn baby in utero or during the birth process as the fetus passes through the birth canal, or after birth during breastfeeding. Studies show that if an infected woman takes anti-HIV medications during pregnancy and delivery, and if the newborn also receives appropriate treatments for the first 6 weeks of life, the chances of HIV transmission occurring are less than 5%. Care for HIV-positive pregnant women can include combination therapy to reduce maternal viral load, continuing anti-HIV therapy during labor and birth to protect the baby while it's exposed to HIV in blood and cervical secretions, and choosing a birthing option that poses the least risk to mother and baby.
Most people think that a positive mother would have a positive baby. That is not true. That is not true. As long as a mother is in care, taking her meds, doing what she needs to do, and being followed closely by a physician, then they can ensure that a baby is born HIV negative. Same with having a positive father, assuming that because of one of the parents or both of the parents being positive, that they would automatically have a positive baby. And that is not true. That is the greatest myth that there is out there, that a positive woman or a positive parents can have a negative baby, but it is so. The Florida law is that all pregnant women who are in care are tested during their first trimester and their third trimester. Private doctors are required to ask women to take an HIV test. It is solely up to the woman to accept or deny, but the test has to be offered for a pregnant woman to do their HIV test. And again, that's both in the first and the last trimester of their pregnancy. With TAPWA, we ensure no matter when a woman comes through our door that they're offered an HIV test. They may have had one 3 months ago, but something could have been going on during that time. They could have had risky behavior. They could have been in the midst of something else, but we want to make sure that they are tested at any point that they walk in our door. We're not looking for a positive test. We're looking that when a woman walks out of our door, she knows what her status is. We always hope that it's a negative test that comes back. But if it's positive, it gives us the opportunity right then and there to help this woman, support this woman, walk through the process, link her into care, and get her the services that she needs to ensure that the baby is born healthy.
As with anything with women and what they have when they're pregnant, not everything is passed to your infant. But one of the things that we do when we know that a woman is HIV positive and pregnant, we get them into care as early as we can, and we get them on treatment. As long as we can keep them on, with their HIV medications. And then as the time approaches for the baby, they're given the option. They can have a natural childbirth or they can have the baby through C-section. And then immediately upon delivery, the baby is also given a combination of drugs for 6 weeks to prevent any possibility. If they weren't infected in utero, then we do this for 6 weeks out.
If you or someone you know tests positive for HIV, remember that linkage to care and proper referrals are important for maintaining health, enhancing longevity, and reducing risk of transmission to others. There are compelling personal and public health benefits to getting an HIV-positive person into care before he or she gets sick.
Identifying someone who's positive, it helps to stop the spread of the virus because, as you know, if you don't have the virus, you can't spread it to someone else. So we want to identify the spread of the virus. We want to identify the people who are infected with it, number one. And number two, the people who are infected, we want to lower their viral load. And by doing that, it can stop the spread or at least greatly reduce the spread of the virus. It's something called undetectable or having an undetectable viral load. That doesn't mean that you can't spread the virus, it just means it greatly reduces the risk. And that's the aim, that's the goal, is to have them with an undetectable viral load, to have their CD4 cells, their CD4 count high, and to have their viral load low. So the risk, even if they're having unprotected sex with someone, which they shouldn't, but even if they do, the likelihood of them spreading the virus is greatly reduced by it. So by, number one, identifying those persons who are positive and getting them into treatment early, it's a twofold part. We can greatly reduce the risk of this virus being spread to someone else.
Getting care means delayed disease progression and early initiation of medication, along with regular monitoring of T-cell count and viral load. Without treatment, people diagnosed with AIDS typically survive about 3 years.
Well, early treatment is the key. We know that if we can get you tested and in treatment, we're going to get your viral load down low and we're going to keep you healthy and keep you alive. It's the key to longevity.
Once someone has a dangerous opportunistic illness, life expectancy falls to about 1 year without treatment. Linkage to care and referral needs of HIV-positive people may include, but are not limited to, the following: partner services for sex and/or needle-sharing partners, case management, medical evaluation, care, and treatment, pregnancy issues, mental health services, sexually transmitted disease screening and treatment, substance abuse prevention and treatment programs, and screening and treatment for viral hepatitis. Healthcare for an HIV-positive person may come from a team. Their primary provider may be a physician, nurse practitioner, physician assistant, and a nurse. Other team members may include seeing a social worker or case manager, a dietitian, and even a psychiatrist or psychologist. Treatments for HIV have come a long way. In the past, most patients had to take several pills per day, but today, many people are down to a few pills or even one pill per day.
When we identify a person as HIV positive and we confirm that they are, we get the confirmatory test back, they're HIV positive. Our job now is to make sure that they get to care. It isn't just about referring them and saying, okay, here's the doctor's office or here's the number to the county health department, good luck, see you later, and move on to the next person. It's not that. Linkage means we call for you, we make an appointment for you, we can get you to the appointment, whatever it takes to get you to care. If it means you don't have transportation, we'll find transportation, whether it's getting you a bus pass, arranging for taxi service, whatever it is, we're gonna get you to the doctor's office. And then with your permission, we're gonna follow up to make sure you made your doctor's appointment.
If you find out that you're HIV positive, the first thing that I would do is go ahead and go to your local health department. You can call also the 1-800-FLORIDA AIDS hotline. Ask, they'll tell you who you can get in contact with, where case management is. You can also go to the Florida AIDS Network. You can find information on the AIDS Institute. And there are numerous resources out there. Federal resources, state resources, local resources, as well as just community-based resources.
Linkage means from the point that we find out you're HIV positive, we can confirm that you made it to the doctor and you got to that first doctor's appointment. So that's the linkage. There's a whole bunch of referrals that are done. Once you're linked, you could get referred to a mental health counselor, you could get referred to a housing facility, but the linkage is medical. It's all about linking that HIV positive person, whether they're newly positive or they had fallen out of care, they had been in care before, we find them again, we link them back into care. It's all about getting them into medical care. That's linkage. A lot of people think, oh, I'm HIV positive, I'm just gonna start on meds. A lot of medical providers won't necessarily start you immediately. They're gonna find out if you're ready, because HIV doesn't go away. We can suppress the viral load, but once you start meds, you're on meds for the rest of your life. It is life-changing that way, and on some medications you have to change some things about what you do. Some meds you have to take with food, some meds you don't have to take with food. Alcohol affects meds, recreational drugs affect meds. You have to be very honest about everything that you do and let your doctor know and have that conversation with your doctor.
It's critical that a person stays adherent to their medication. And the reason is, the disease, it creates itself. It keeps multiplying. What medication does is stop that multiplication or it from creating itself. If a person stops taking their medicine, what happens is that the disease is so smart, it has, lack of a better term, changed its form, and that medication is no longer going to work for it. It becomes resistant to it. So the disease then could progress again. And those cases that it does happen, then they may have to go on another type of medication. And there's only so many types of medication that will fight the disease. So it's critical that a person, once they're on a medication until a doctor changes it, stay adherent with it.
Holistic treatment includes antiretroviral therapy, which suppresses the virus by preventing it from replicating while preserving immune function. Alternative therapies like acupuncture and homeopathic treatments can also be helpful, but cannot be relied on alone. Following the advice of healthcare providers for treatment and self-care is a crucial part of staying healthy and protecting others. There are housing, prescription, and insurance assistance programs available to people with HIV. For example, The AIDS Insurance Continuation Program is a statewide program that makes direct payments for the continuation of medical, dental, mental health, and optical coverage for those who qualify.
The AIDS service organization, the community-based organizations, there's many churches all over the state that have their own HIV program, or they work with the other community partners, and they will take the referrals, they'll help. And so what we tell folks when they're testing is, if you're giving that person a reactive result, if you're telling that person they're HIV positive, you need to find out where they're comfortable. What community are they from? Where do they live? Where would they be most comfortable going? In many places, they're fine right in their own county, but there are areas in the state where a person doesn't want to go within their county because everybody knows them, and there is still a stigma, unfortunately, to acquiring this disease. And so we have to be ready to refer them to someplace maybe outside of their area where they live in order for them to get assistance.
You can learn more about how to find these resources and others during the upcoming final chapter. Remember, in order to continue to create positive changes in the fight against HIV and AIDS, communities must remain diligent and engaged. Business leaders, municipalities, families, and churches are all important allies. Together, we can help fight stigma and continue to put policies in place that promote access to care. If you are studying Module 2 of the program, please pause the video at this time to review the viral load testing, partner services, service needs for positives, and consideration for persons in correctional facilities sections of your materials before moving on to the final chapter. In addition to various community-based organizations, every county has a health department that can provide services for prevention and care. If you or someone you know is looking for HIV prevention, care, or community resources, call the Florida AIDS Hotline at the numbers shown or visit wemakethechange.com. With your help, we can continue to reduce infections, increase status awareness, provide linkages to care, and fight stigma. On behalf of everyone at the Florida Department of Health, we thank you for participating in our program.